back. This is Boomer Life on CL650.
Mr. Sandman, bring me a dream. Bum, 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 bum. Make him the cutest that I've ever seen.
Hey, and welcome back to Boomer Life on CL650. Today we're talking about your health and the importance of a good night's sleep. From SleepShop and the sleep experts, we have Farouk Manji here, and also Dr. John Fleetham, who is the co-director and the founder of UBC Hospital Sleep Disorder Program, which is part of Vancouver General Hospital. Now, Dr. Fleetham, you mentioned in the previous segment that Vancouver is a world center for this kind of research. You were part of that, I'm guessing?
Yeah, I mean, it's... there's areas of interest in terms of research and everything like that, and so the group at UBC and the group which has developed there over the last 30 years is, has a big teaching and research program, and is noted to be a center of excellence. It's in terms of this field. So yes, we're blowing our own horn a little bit, but
sure, why not?
Recently there was an evaluation in terms of everything like that. Some of the work that we've done sort of placed us number one in the world. So yes, but Vancouver is very good for many different areas in terms of medical research.
It's funny because we don't, I think, blow our horn enough in Canada, and it's good to know that. And I'm sure many people listening had no idea that we have a center of excellence here at UBC. So what kinds of things have you found there around, say, sleep apnea? What is it, and how did this come? How did you learn about it over the years?
Well, just to start off, sleep apnea really refers to stopping breathing during the night. So apnea means stopping breathing. Everybody always thinks there's just one type of sleep apnea. In fact, there are 5 different types of sleep apnea. Essentially, there's some people who can't breathe when they're sleeping, and there are some people who don't want to breathe when they're sleeping. So the classic one that everybody remembers is obstructive sleep apnea. So as I described, when you're awake, you have tone in all your muscles, and when you fall asleep, you lose that tone. In your mouth, you have the tongue. You have a whole variety of other muscles, and when you fall asleep, you lose that tone. The tongue relaxes, and it narrows at the back of your throat, and the noise that many people make when that gets narrow is the noise of snoring. And everybody jokes about snoring, but snoring is a symptom like cough is a symptom. In some people, it's about 1 in 20 men and 1 in 40 women, the tongue falls all the way back and cuts off the breathing. So people fall asleep, start snoring, then the tongue falls back and cuts off the breathing. And then after a period of time, the brain says, hey, I'm not getting any oxygen, and then they will wake up and start breathing again. And we frequently see people who will stop breathing for 1 or 2 minutes and go through this cycle 500 or 600 times a night.
Wow.
Which is clearly bad for them, causes them symptoms and causes them significant health consequences.
I would guess, yeah, the restless sleep is one part, but the lack of oxygen for a minute to a minute and a half is quite severe.
Yeah, the analogy is like me sitting in a chair beside your bed and putting a pillow on your face when you're asleep. And then what you do, if you're smart, is you wake up and tell me to take the pillow off. And then as soon as you fall back off to sleep, I put the pillow back on your face.
And so,
to bring it back to a car analogy, if I drive my car at 30 miles an hour all the time, it's not too tough on the engine. But if it's stop, go, like typical Vancouver traffic, then that's bad on my system. And if you do it for a long time, it's, causes a variety of things, including heart attacks, strokes, heart irregularities, cancer. The consequences of untreated sleep apnea are quite broad.
So why do men suffer this more than women?
And
why do men snore more than women?
It's hormone related. With respect, men tend to look like apples, so distribute their weight around their neck. Women tend to be more in terms of pairs. It's interesting, the prevalence of sleep apnea increases in women after the age of menopause when there's a change in the hormone profile. One of the best predictors in terms of sleep apnea is neck circumference. And so as men put on weight around their abdomen, then they tend to put it around their neck. As it gets bigger outside the neck, it gets smaller inside the throat, and that predisposes it.
So the fat you're putting on outside is also you're adding on the inside.
Yes, it's interesting. If you do scans, it's in the back of your throat, it's in that uvula, it's in your tongue. And if you lose weight, actually, if you look at people's mouths, it will become wider there. Sleep apnea varies also between different ethnic groups. It's more common in people with an Oriental origin. So it runs in families like everything else runs in families.
I had a neighbor who snored badly, and he had his uvula removed. Have you heard of that?
Yes, probably not a good idea.
Well, he didn't seem to think so after the surgery because he said it was murder recovering from it.
No, I mean, it sounds very good, but it's rarely effective. And also, quite often those patients actually have sleep apnea, and it then makes the treatment of the sleep apnea more difficult. So there was a phase for doing that sort of 10, 15 years ago. I think it's less commonly performed now.
So how do you suspect you have sleep apnea? Obviously, your partner would be able to hear your snoring and maybe able to detect the fact that you've stopped snoring and are not getting oxygen. But how do you typically get the diagnosis? What's the process? Somebody's feeling really groggy and not themselves during the day, but it's a gradual thing over years, so they might not notice that they're feeling groggy. They might just think that's their new normal.
Yeah, so it starts in two different ways. I mean, it's probably in this field of medicine, it's most important to have a bed partner or a spouse. And so quite often people recognize that snoring is an issue, and they will start off saying, wanting to do something about the snoring. If you've ever shared a room, as I have, with someone with sleep apnea, it's not the snoring that drives you crazy. It's the periods of silence. You're lying there saying, breathe, breathe, breathe. And so, we will see many patients, usually men, dragged in by their wives, because they've noticed they're stopping breathing.
Because they're not sleeping either. They're like, is he kicking off, right? Is this it?
Well, but sometimes the patients will have no symptoms at all, and they come in and say, why are you here? And they say, I have no idea why I'm here. And then the wife says, well, because you do this. But then the symptoms, patients will have symptoms. And so the classic symptom is if you sleep 7 or 8 hours, and if you wake up in the morning and you just don't feel refreshed. If you wake up and you feel groggy and I just want to go back to sleep, that's probably the best indication that maybe something not perfect in terms of your sleep. Sometimes people will wake up many times during the night. And then the other symptom is fatigue, and especially daytime sleepiness. Again, people don't take sleepiness very important. And, I certainly go to some committee meetings. I'd be grateful to fall asleep. But there are jobs which are very important in terms of staying awake in the transportation field. But I've seen judges who've fallen asleep during trials. I've even seen anesthetists who've fallen asleep while giving operations. Sleepiness can be quite devastating.
I saw a X-ray technician or whatever their machine they're using at the airport, where all the bags are going through the belt, asleep, looking. I said to the person running, I said, by the way, that crack security guard there is asleep. That was an early shift, but yeah.
I mean, quite often people are working long hours.
Yeah.
Just in the press today, there's a story of a physician who worked overnight and he fell asleep and died on the way home.
Wow.
And so.
Well, this is a big problem with medicine, with the way that interns are basically kind of put through they run the gauntlet with all the hours that they have to do when they're starting out in medicine, and there's been really no change with that, has there?
No, there's been a lot of change. In fact, no, I mean, when I trained, I worked 1 and 2, and I was up 1 and 2 nights, and it was like boot camp, and it was, you had to tough it up, and you were a wimp if you didn't do it. But now there are a whole variety of studies saying that residents are more likely to have traffic accidents, residents are more likely to have needle stick injuries when they're sleep deprived, and there have been, it's better done in Europe than it is in North America, but there are now strict guidelines in terms of how many hours they can work.
That's good. Now, to give us an example of somebody who's sleep deprived, we'll pick on a scale. Maybe you have a scale that you use, but out of 100, you're feeling great and rested. For somebody that's getting a poor night's sleep, how much brain activity is suppressed, and how groggy and how sort of dumbed down do you feel compared to somebody that's running at 100?
It's tough to give a number to that. But the best impact is when you treat it and they come back and say, I feel 1,000% better.
That's a big number.
And that's, so, I'm a respiratory physician. I treat asthma, COPD, lung fibrosis, lung cancer, and in that field, unfortunately, people don't come back and say, I feel 1,000% better. And doctors get their kicks from making people feel better. And for someone to come back and say, I feel great, thank you so much for doing that, you transform people's lives. So, it depends on how bad they are, and it doesn't happen with everybody, but you should not underestimate the value of a good night's sleep and waking up feeling good. You have more energy, you have more patience, it transforms their lives in many different aspects.
That's the voice of Dr. John Fleetham. He is the founder and co-director of UBC Hospital's Sleep Disorder Program, which is part of Vancouver General Hospital. We talked about sleep apnea. When we come back, we're going to talk about the treatment for sleep apnea right here on BoomerLife on CL650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL650.